look, I'm getting these really funny heartbeats. Oh, that's anxiety.
Other aspects of lifestyle which may be relevant.
Be patient with yourself and just build up gradually.
So I just needed to have them work with me.
There's a whole bunch of cardiomyopathies.
Benefits of doing genetic testing.
Take their own heart monitor. There's better types of fat.
Try and find a cure for inherited heart muscle diseases.
Hi everyone, great to be here again. Some of you might remember me from last year. I'm going to be building a bit on what we spoke about last year, but with a bit of introduction to genetics as well, so we're not going in completely cold. And as we're going through, have a think about your questions. I think there's an app where you can put your questions on, and we're going to have a lot of time at the end for answering questions, because coming here over the years, I've noticed that I always get really good questions at the Cardiomyopathy conference. So please do ask me a few. So I've been asked to come and talk to you all today about genetics, advocating for yourself and for your family as well. And I'm a genetic counsellor. I work at the Brompton Hospital and Harefield Hospitals. And actually the role of a genetic counsellor, a lot of that is about supporting patients through the process of having genetic testing, getting their genetic results, and allowing you to have that information and using it to advocate for yourself and for your family members as well. So hopefully, after this talk today, you'll have a few more of those tools going forward. So I thought we could cover a few of the fundamentals of genetics, which is something we went over before. So about knowing the cause of cardiomyopathy and how that can be helpful for us, both in terms of managing cardiomyopathy, but also useful information for the family as well, because going forward, that can help us with something called Cascade screening, which is screening for family members. I'm going to talk a little bit about family planning, so how we can use genetic information to inform having children in the future, so understand what the chances are of passing on cardiomyopathy, and sometimes managing those risks as well, and sort of planning a pregnancy. And I thought, given there's been some really exciting developments in genetics recently, I'd give you a little snapshot of something I heard about, which is quite promising for the future as well. And the question that I get asked all the time, the golden question at this conference, how do I access genetic testing? And if I had the appropriate genetic test, is there an up-to-date test that I could be having done? So we'll talk about that at the end as well. So let's start with some fundamentals of genetics. So in this diagram here, we have a cell, and within the cell is the blueprint for building our bodies. So our DNA, our genetic material, is essentially the instructions for building the human body. And if we look within the center of the cell, we have the chromosomes. We have 23 chromosome pairs, and within the chromosome, we carry our genetic material, our DNA. So if we were going to pull out that chromosome, we can pull out a strand of DNA, and then that strand could be sectioned up into what we call genes. So genes are essentially instructions. So we have all different instructions for building usually proteins within the body. So a gene will code for a specific protein within the body, and that protein will be used to, for example, build some of our organs or control how an organ functions. So we've got a lot of genes. Humans, we've got over 20,000 protein coding genes in the body. And nearly all of our genes come in pairs. So we get one copy of the gene from our mum and one copy of the gene from our dad. So if we had all this genetic material in our body just hanging out loose, then it would all be a tangled mess. So actually, the way that the body stores this is in these very tightly bundled packages called chromosomes. So the chromosomes are just the bundles of DNA, and they're the units of inheritance that we get from our parents. So the tightly packed bundles, if we pull them out, that's where we see all of the genes along the strand of the DNA itself. Okay. So when we're doing a genetic test, what we're essentially doing is getting some cells from your body. So usually we do that with a blood sample, or we can do it with a saliva sample. And with those cells, we're able to isolate the DNA. And then we do something called sequencing usually, which is where we're actually reading through the genes and seeing if there's any specific changes within the genes that have stopped them from working properly, because that might help us understand why someone's developed a condition like cardiomyopathy. So I was thinking today that we could talk about how genetics and environment can both play into developing health conditions, particularly cardiomyopathy, because as we all know, cardiomyopathy is usually a genetic condition that can run in the family, but it's very variable, and there's lots of things that can impact on the way that cardiomyopathy develops, the symptoms that we have, and the treatments that we require as well. So whilst my job is looking for the genetic cause, there can be lots of other causes as well, and it's not just one cause, it can be the interaction of multiple causes that can cause someone to develop a condition. So I quite like this diagram here, which shows all the interactions that can cause someone to develop a condition. So on the bottom, we have genetics, so the genetic cause of a condition. So often with cardiomyopathy, that can be a single gene, a single heart gene that codes for a protein that builds part of the heart muscle that has a change in it and it's not working properly. That's the case for some people with cardiomyopathy, but other people might have something that's called polygenic cardiomyopathy. So it might be multiple genes interacting that actually causes their condition. And something we also are learning more about at the moment is epigenetics, which is the way our environment can affect the way our genes are expressed. So already, other factors are coming into play. It's not just our blueprint that's actually coding for our heart and how it's looking. So thinking about other factors that can contribute to cardiomyopathy. So you may have heard that some people with cardiomyopathy may have had a condition called myocarditis, which is where a virus has affected the heart muscle. So viruses are something we need to think about. Maybe other health conditions have affected the heart, and that has caused damage to the heart muscle. Certain pollutants, certain chemicals that we've been exposed to, but also the choices that we make in our life as well, in our lifestyle. So are we drinking alcohol in our life? Is there specific drugs that we're taking either recreationally or to treat a certain condition? Have we got pregnant? Have we carried a child? That can put extra stress on the heart as well. Exercise can factor in, diet can factor in as well. So when we're trying to understand the cause of cardiomyopathy, often it's not one thing that's caused it, it's a combination of factors. How do we understand what factors actually contribute to someone developing a condition? Well, there's been lots of studies over the years, and one of the main ways that we're able to draw this out is through looking at identical twins. So back in the day when we didn't really understand the cause of any health conditions, we used to use identical twins as a way to study this, because if something is a purely genetic condition, we would expect if one twin has that condition, the other twin would have it in exactly the same way as well, because identical twins carry nearly exactly the same genetic material. So we can use identical twins to better understand how much of a condition is caused by genes and how much of it is caused by environment. So I thought I would have a look and see if there was any twin studies into cardiomyopathy. And actually there isn't a lot of data out there, because I thought it would be really interesting to know if perhaps there was identical twins where one of them had cardiomyopathy and the other one didn't, because it would help us understand a bit more about the amount that genetics are involved in the development of the condition. I did find this study. It's a bit of a small study, so it was looking at 11 identical twin pairs, and they followed them for a number of years. And what they found was these pairs that they were looking at, they all had the same conditions. They all had hypertrophic cardiomyopathy. So that was the same amongst the twins. But actually, when you compared the twins' hearts, the hearts looked different. So they had the same condition, but one twin would have a thicker wall thickness than the other, and one would have a different ejection fraction to the other. So being an identical twin does not mean you have an identical heart. actually other factors have been at play here that might have caused this variation in the way the condition's presented. Maybe one twin lives in one country and another twin lives in another. They have a different diet. Maybe one twin exercises a lot more than another. Maybe one twin has developed high blood pressure and the other twin hasn't. So it's impossible to tease out all the different causes, but it just shows that not everything is determined by our genetics. There's lots of different things that can factor in. So, gene plus environment equals cardiomyopathy. Is it that simple? Well, it never is it? There's so many different factors. So there's many different genes that can cause cardiomyopathy. Majority are genes involved in building the heart muscle, but they all involved in building different parts of the heart muscle, and so there's different effects on them when there's an issue. And there's so many different environmental factors. How can we actually measure them, and how can we determine which ones have caused someone to develop a condition? So in certain circumstances, gene plus environment can equal cardiomyopathy, but not others. I thought I'd give you some examples, again, that were published in the literature of situations where gene and environment have actually caused someone to develop cardiomyopathy. So one example here is a woman who was diagnosed with breast cancer at the age of 43, and she was treated with chemotherapy, which would be the standard chemotherapy that someone with breast cancer would take. This woman, she developed shortness of breath and presented to A&E. And when they scanned her heart, she had an enlarged left ventricle and poor function of the left ventricle. So her EF was 12%. So she was diagnosed with heart failure, essentially. And this woman, we were trying to understand why she's actually developed heart failure after taking chemotherapy. Most people with chemotherapy don't develop heart failure, but people who have an underlying susceptibility, like this woman, may develop cardiomyopathy. So this woman had a genetic test, and a specific gene was identified from that test. So the gene is TTN, or titin. It's a gene that we all have. We've all got 2 copies of it, and it builds the heart muscle. But in her pair of genes, one of the genes was not working properly. And so lived her life normally. We don't know if her heart looked normal before she had the chemo. It probably did. But that extra stress of the chemotherapy, which can have a toxic effect on the heart muscle, actually pushed her into developing heart failure. So some people are sitting there with a risk that may have never developed unless you'd actually developed the breast cancer and had the chemotherapy. So it's just one instance of where genetics and environment can interact. And this specific gene is the most common gene that causes dilated cardiomyopathy. And there's been quite a lot of research now into the fact that this gene is what we call low penetrance. So a lot of people, not a lot, but people in the general population might carry a faulty copy of this gene and have completely normal hearts. It takes an extra stress for them to actually develop cardiomyopathy. And that extra stress could be chemotherapy, it could be pregnancy, it could be a virus, it could be drinking alcohol to excess. That's just some of the things that have been linked to the development of cardiomyopathy with this specific gene. So it's a risk factor for developing the condition. And actually, when they went back to this woman's family, they screened the rest of the family and found that her mother actually had dilated cardiomyopathy as well. So she also carried the same genetic variant. So although there wasn't that history there before, there was actually a context to her developing this condition. So, second example, exercise. So we've got a family tree on the left. This is what we use in genetic counselling to draw out families. So the squares are men and the circles are women. And so we have 3 siblings, 2 women and a son. And they're all very sporty. They're all competitive swimmers. And the eldest daughter had a cardiac arrest during her training. And she is screened, and actually her heart shows signs of arrhythmogenic right ventricular cardiomyopathy, and her siblings are screened and have the same condition. And we do a genetic test, and that shows a genetic variant called PKP2. This is a gene that codes for a protein that anchors the heart muscle cells together. So it's something that strengthens the heart muscle. So if we're putting the heart under a lot of stress by doing competitive level swimming or other kinds of athletic training, that can actually bring on signs of the condition. So you might think being very sporty would keep your heart very fit, but actually, unknowingly, if you've got a variant within this gene that's making you susceptible, doing all that exercise actually wasn't a good idea because you've now developed cardiomyopathy. And interestingly, in this study, they did screen dad, and he also carried the genetic variant, but he wasn't sporty, and actually his heart was working fine. So it's that interaction between the gene and the environment, the choices we make in our lifestyle, that actually brought on the condition. And this does lead to a lot of fear with patients who have a diagnosis of cardiomyopathy or a genetic test which shows that they carry a specific genetic variant. Can I actually exercise? And for the vast majority of patients, you are still advised to exercise, but with specific genes, particularly this gene PKP2, we would usually say don't do that kind of competitive level athletic training, because actually that's going to put a lot of strain on your heart and you don't have as much strength in your heart muscle as someone else in the general population. So this kind of genetic information can guide us going forward in our lives and actually empower us, because if we know we have this, it can guide what career path we might go down. If we have this genetic variant, we might not decide to be a professional footballer. We can still go out for a jog, but we're not going to run an ultra marathon. So it's just a bit of information that you can use if you have it going forward. Unfortunately, in this family, they wouldn't have known that they had this, and they had already done high levels of sport since a young age, and so this condition had developed. But in this study, they did say that actually when the siblings stopped exercising at a competitive level and started taking their medications, their heart function did recover a lot. So again, they were able to sort of manage the condition, but some of the damage had already been done from that athletic training. So yeah, just a quote from the study that they've sort of hypothesized here that the highly intensive exercise from early childhood is what could have contributed to the development of the condition. So how can we use this genetic information to empower us in our own families? What can we do if we find a genetic cause in terms of screening other family members? So I've got another one of my trees here. So the lady at the top has been diagnosed with cardiomyopathy, and we put the plus here to say she's had a genetic test and we found the specific gene that caused it for her. One of the main things we can do with this information is screen her family. So the word cascade it's kind of like we go down the generations, essentially. We're cascading down the generations to work out who needs to be checked. So with quite a straightforward blood or saliva test, we can screen her children. So her first daughter has the test and she carries the genetic variant and she has some heart scans and she also has cardiomyopathy. Her second daughter has a test and she also carries the genetic variant, but she has her heart scans and her heart is normal. And the third child, the son, is negative. So what can we do with this information? Well, firstly, we're seeing a bit of discrepancy in the family. So there's two daughters. One, they both have the gene, one has the condition, one doesn't. Why has that happened? Well, we can't say exactly, but we can theorize that this is all about the gene-environment interaction. So the gene is a risk factor for developing the condition, but perhaps there are other things that have happened, a difference between the two siblings where one has developed it and the other hasn't. So maybe the daughter who hasn't developed it, maybe she has other genetic factors that are actually protective of her developing the condition. Or maybe one daughter was very sporty, the other one wasn't. Or maybe one daughter had a virus, the other one didn't catch this really bad virus that went and affected her heart muscle. So it can often be impossible to prove, but we can see these patterns in the family where some people have the condition and some don't. It could be that this daughter who doesn't have the condition at this point may develop it further down the line. So we do need to keep her under regular heart scans, which would be every 1 to 2 years. That should be screened. And so we're talking about the cascade. So we're going to go down the generation now. So we test the woman's son, and he has the gene, and we do the heart scans, and he also has cardiomyopathy. So that's where we can sometimes hear this phrase about skipping a generation. So when we look at this family, cardiomyopathy looks like it's skipped a generation, but that's talking about the condition and the diagnosis, but not the gene. So the gene itself cannot skip a generation, but actually it just looks like that because the daughter hasn't actually developed any signs at this point. So for example, with the son who doesn't have the genetic variant, if he had a son in the future, we wouldn't need to test his son. The gene isn't going to skip a generation to his son. If he doesn't have the gene, he can't pass it on to his son. So that is one of the bread and butter things that as a genetic counsellor we do, is screening the family and working out who needs to be checked. Something else that I do as part of my work is talking about family planning. So when we have patients who either have cardiomyopathy or carry a genetic variant associated with cardiomyopathy, and they are thinking about having children, they may want to know what is the chance of passing on the condition, and sometimes what can I do to prevent passing it on. So for most forms of cardiomyopathy, it's a dominant condition, which means there's a 50-50 chance of passing on the genetic variant with any pregnancy. So a family planning discussion will be talking about those risks and thinking if that's something that someone would want to go ahead with natural conception. So a lot of patients do go ahead and have children naturally, but then there would be the discussion about screening for their children. So either their children would have regular heart scans, or they might think about genetic testing for their children, which would show whether they need to continue with heart scans in the future. So that's a very common option that people go ahead with. But some people feel that they don't want to have that risk of passing on the condition. So there are various options we can talk through, and these are tailored to the specific patient, the specific genetic cause, the specific condition. So I thought I would talk through a few options today in a bit more detail. So one of them is preimplantation genetic testing and prenatal testing, but there are other options that I explore as well. So sometimes people think about using a donor, which could be a sperm, an egg, or an embryo donor. They might think about surrogacy, particularly women who have cardiomyopathy, when they're told it might be dangerous for them to carry a pregnancy, might use a surrogate, and also the options of adoption and fostering as well. So just to focus in on these two, because they're kind of interesting from a genetics perspective, I guess. So preimplantation genetic testing is a form of IVF, which some of you might have heard of. So it's using a sperm sample from the male partner and an egg sample from the female partner and creating an embryo outside of the womb. And then the extra step further than IVF is actually taking a small sample of cells from each embryo at an early stage and testing to see if the embryo has inherited the genetic variant that causes cardiomyopathy. So with that 50-50 chance, if we had embryos, we would expect 50% of them to have inherited the genetic variant and 50% of them to have not inherited the genetic variant. So we can use that to choose which embryos we're going to use. And those embryos would then be implanted into the womb with the hope of resulting in a pregnancy. This is a procedure that is funded on the NHS, so patients can go through that route, but there are quite strict eligibility criteria, as there is with a lot of fertility treatments in the NHS, and it's not an easy or straightforward process. People who aren't eligible under NHS criteria might go private for this testing. And then some other options in terms of planning a pregnancy. So some patients choose to conceive naturally, and then they might have a test during pregnancy. And if the fetus has inherited the genetic variant, there would be the option of ending the pregnancy at that stage. So it's done quite early in pregnancy. Traditionally, this was done, with an invasive test. So it would be a needle in the belly, and they take a sample of either amniotic fluid or from the placenta, and they test the sample to see if the fetus has inherited the variant, and then if they have, they might end the pregnancy. And something developed more recently is a non-invasive test, which is when rather than putting a needle in the belly, which has a small risk of infection, and so a slightly increased risk of miscarriage, we can do a non-invasive test, which is where a blood sample is taken from mum, and actually the fetus, some of the DNA from the fetus is actually circulating in mum's blood, And so a genetic test can be done on that DNA that's carried in mum's blood, but from the fetus. And it can be done earlier, so it's around 9 weeks of pregnancy, and that can tell us if the fetus is going to be affected or carry the gene that causes the condition. So, my golden question that I always get asked is people who haven't actually been able to access genetic testing yet, because I'm conscious I'm here talking about how useful genetic testing can be, but not everyone has access to it or has been able to access it so far. So there has been a bit of a postcode lottery on who's been able to access genetic testing with cardiomyopathy so far, and there's been sort of a national initiative in general across NHS England to make genetic testing more accessible to patients for all different conditions. Cardiomyopathy is included in that. So there's something called the National Genomic Test Directory, which is something that doctors and nurses and genetic counsellors can use to determine if their patient is eligible for testing. And actually, the eligibility for criteria for cardiomyopathy aren't too strict, so most people probably will be eligible for testing if we review those criteria. And all that testing is nationally funded now through NHS England. It's a different case for England, for Wales, Scotland and Northern Ireland, but for NHS England, it's under this system. So that is something that can be discussed with your healthcare professional if you would like to be referred for a test. If you're still struggling to access testing, you can talk with your GP. They can refer you to your local genetic service. There are genetic services throughout the UK, or to your local inherited heart conditions clinic. So that can be a GP or a cardiologist referral if they aren't able to sort of organise the testing themselves. And you know, you can always get advice from non-profit organisations. Gene People is a charity that I often recommend to people because they have a helpline that's manned by a genetic counsellor. So they can help you find out what is the best way to access something in your area if you're struggling to find out the way. But obviously, I'm sure Cardiomyopathy UK and British Heart Foundation and all these other heart charities are perfectly capable of answering these questions as well, because this is the sort of thing that patients want to know. I often get asked as well, people who've had genetic testing before, maybe a few years ago, and the test was negative, so no genetic cause was found. Is there more testing that can be done? And the answer is maybe. So, you know, we're learning more and more all the time. We're discovering new genes that cause these conditions. And so, again, check in with your doctor, and they could see if there is actually an updated test for you, because it could be that at the time you had your testing, the gene that caused your cardiomyopathy wasn't discovered yet. It wasn't on the test. So it's always good to check in after maybe about 5 years, and there may have been some developments. There's also lots of research studies you can get involved with. There's the Heart Hive people outside that you might want to speak to, and they're doing lots of interesting work in genetics and cardiomyopathy as well. So finally, I thought I'd end on a positive note. So I just found out about this recently. So the first patient has been treated with a gene therapy for hypertrophic cardiomyopathy. So don't ask me lots of detailed questions because it's definitely outside of my knowledge base. But essentially, a clinic in America has been able to use an infusion using a virus that the hope is the virus will bring a healthy copy of this gene, MYBPC3, into the heart muscle. So this gene can cause hypertrophic cardiomyopathy, and the hope is by infusing this gene and fixing the function within the heart muscle, this could improve function for people with cardiomyopathy. So it's only just happened. So I don't think we know the results yet or if this works, but it's just promising stuff for the future. There's already this work going on where we might use gene therapy and develop better targeted treatments if we know the underlying genetic cause. Okay, so that's everything from me. I will open it up to your wonderful questions.
Thank you, Ellie. We do also have some questions on the app, so I'll take some from the floor and then we'll look at the app as well. So thank you, it was really interesting. Anybody? Yep.
Hi there, thanks for everything that you do, because last year you've enabled us to go back to our care people and sort of have a reassessment after the 5 years of the genes, I still get a little bit confused. So say one of you has dilated cardiomyopathy, one of you doesn't. What is the chance of your child having it? I still get confused with that.
So you mean if someone has cardiomyopathy,
Yes.
what is the chance of their child developing
Yes,
it?
yeah.
And this is before they've had any genetic testing?
We've had some genetic testing, but they couldn't identify what it was.
Yeah.
So they're doing it again at 5 years for looking, because they looked before at the lamin genes and all of that. But there's been changes, so we still don't know yet. Yeah.
Yeah, so it's a really good question, and essentially it's not something we can put a number on, because if we've done a genetic test and we haven't found the genetic cause, we can't say specifically what has caused the cardiomyopathy in the family. If we're going off the assumption that it's a single gene that's caused it and it's a dominant condition, which for most people it is, but not everyone, then essentially the chance of children developing it is up to 50%. Because if we're assuming there is a gene there that's caused it, it's a 50-50 chance whether each child has inherited it. But as I've shown earlier, carrying the gene doesn't mean you're going to develop it. So it's up to 50%. It's not 50% itself. And that's just assuming that it's a single gene in your family that's caused it. So I know that's a bit of a complicated answer,
that
but
actually makes sense.
yeah.
Thank you. Thanks very much.
Yeah, no worries.
So the question is, having, in your experience, when you talk to people about the possibility before they have the genetic testing, how many people decide against having the testing, having spoken to you? Bearing in mind it might show nothing.
Yeah. So I find, there's two different kinds of testing. So there's the diagnostic testing, which is when someone has cardiomyopathy and we're doing a test to find the cause. I'd say for most patients who have an appointment with me, they go ahead with the test because they think it's not going to change anything for me. Let's see what we find. I think people, I've got a bit of a skewed statistic because that's the people who show up to an appointment with me. If they didn't want to do it, they wouldn't come. But I'd say most people do go ahead. It's a different question. Say if we've found the genetic cause and then there's the option of testing for relatives, which is, we call it a predictive test. So they're seeing if they carry the genetic variant, which is predicting their risk for the future. And in that case, not everyone takes that test up. Because, if your heart looks normal, do you want that information that you might develop something in the future? It could have implications for your career going forward. It could have psychological implications. Again, I'd say most people who actually get to the appointment with me do go ahead, but there is, a good minority that actually don't go ahead. They just get the information and then they decide to leave it for now. Yeah, it's a good question.
Making me exercise. Walking off my dinner.
Thank you. It was very interesting to hear about what causes the TTN gene and the BKP2 gene. And I've just wondered what causes the MYBPC gene that you just mentioned at the end there.
You mean like what the triggers are?
Yes, if people know.
Yeah, that's a good
Thank you.
question. So from what I understand, we don't know as much about that one. So there are some genes, the examples I've given are ones where we clearly have identified these environmental triggers. But with MYBPC3, we haven't really teased it out as much. We do see variation in families, but we don't know why that is. I think we feel it could be other genes interacting as well. But I don't know of any environmental factors except maybe like athletic level training. But even that I don't believe is proven at the moment.
So I'm very interested to know if there is any research or if you already know. From people I've spoken to, it seems like as the gene gets passed down the generation, the condition gets worse, or they present with symptoms earlier than their parent did or their grandparent did. Is there research being done into why that is the case, or is that not the case and it's just that's what it looks like it is?
So from my experience and my knowledge, that isn't the case. So we might see that pattern in some families, but that pattern has probably happened due to chance. So there are some genetic conditions that get worse with the generations, but not cardiomyopathy. We just see variability. Yeah.
Shall we take some from the app?
Yeah.
So what are the best ways to communicate the genetic risk of cardiomyopathy to affected families?
Oh, best ways to communicate. Well, I mean, I think one of the ways is to kind of normalise it, because actually cardiomyopathy is a relatively common condition. And when we Google cardiomyopathy, it's terrifying, you know, the first things that pop up. And so it can be just talking about like my experience of working with families and how we can be really proactive about screening and treating things if we need to. So I guess kind of being reassuring, to be honest. I don't think we need to scare people into action. We just need to inform them, because the people who don't turn up for appointments, who don't get checked, are the people who are quite scared usually. Because of the things they've looked at online, and they think it might be a death sentence, when it doesn't have to be the case at all if we are proactive and we look at things at an early stage. Yeah.
And another one. So what lifestyle changes, i.e. diet, may help adults and children with a genetic risk to reduce their likelihood of developing cardiomyopathy?
Yeah, I get asked this a lot. I don't think we know. I think the things that we recommend in terms of diet are what we'd recommend for anyone, which is, you know, a healthy, balanced diet. There's no specific thing that we would tell people with cardiomyopathy to avoid. You know, we do know that like drinking excess alcohol can cause certain forms of cardiomyopathy, so kind of limiting things like that. But in terms of food and things, I don't think there's anything specific that we advise at the moment. It's just the normal, boring, healthy eating recommendations. Yeah.
Mediterranean diet was recommended.
Yeah. Oh, yeah, there we go.
Red wine, though.
Yeah. Mediterranean diet's quite a nice one to do, isn't it? So there we go.
And just another one here. So what are the requirements for testing for a specific faulty gene in children? I have been told that filamin, I don't know if I'm saying that right, filamin C isn't a defective gene for DCM yet.
So filamin C is a gene that's been discovered over recent years to be associated with dilated cardiomyopathy. So it is a gene that's been associated, but certain families, maybe we haven't proved that that specific gene has caused it at this point, because there's all different variants that can exist within that gene. And so if we can't be certain that that gene is the cause, we wouldn't usually test children. We want to be certain that we're testing them for the right thing. Yeah.
That was so interesting. I'm kind of new to, I have cardiomyopathy, obviously, but I'm new to the kind of a discussion about genetic testing. And I'm interested in what the kind of general guidelines or community thinking is when you could say, effectively, I could have my adult children just regularly monitored with whatever, echo or whatever, or gene testing, or nothing. There's or a combination of the three, because there's kind of like, there's a decision to be made not just about whether to gene test, but whether to test or monitor at all. And I wondered if there's any kind of, you know, practice in that is kind of the kind of received wisest thing to do.
Yeah, it's hard to speak on an individual level, I guess, but in general, if someone's diagnosed with cardiomyopathy, usually we recommend screening, so heart scans for first-degree relatives, so their children, unless, you know, there is caveats to that where maybe we think that cardiomyopathy isn't a genetic form, there's something else that's clearly caused it, and then maybe they wouldn't recommend screening. But usually, as a precaution, we recommend those heart scans. And then if you meet the eligibility criteria for genetic testing, you could have that test, and then if the genetic cause is found, that opens up the possibility of a genetic test for your kids, which is a whole different thing to the heart scans, echo, ECG. So it kind of depends on your diagnosis, if you're going to have a genetic test, and what the results of that are before we know exactly what the plan is going forward.
Yeah. Okay.
Yeah.
Thank you.
I do have a question. Thanks, Ellie. So a case study, or me, and my family. Lambing positive in the womb, spontaneous with me, apparently it sorry, my dad has got dilated cardiomyopathy, but apparently not related to my cardiomyopathy. But I did notice on, I think, Perry Elliott's, one of his slides, that my dad's specific DCM gene is SCNF5 or something, which seemed to be closely related to lamin. And that begs the question of, are they related? Is that the missing link between me perhaps getting it from my dad and it wasn't in vitro or in the womb? And I just wanted to ask that question. Does that make sense?
Yeah, yeah, definitely, definitely.
Fine.
So if the specific gene change that caused your cardiomyopathy happened for the first time in you, then it's, as far as we know, not linked to your dad's at all. Right. It's just a coincidence.
Even though lamin can lead to DCM?
Yep, yep.
Is that why my cardiologist is really fascinated?
Yeah.
Two cardiomyopathies in the family that are
Yeah.
similar.
Exactly, yeah.
Have we not found a missing link then? Are you sure?
Yeah. Yeah, so I mean it is a puzzle, but but as far as we know the two aren't linked. Right. Yeah, yeah. And it's two separate genes and the genes aren't linked together, it's two separate things. So yeah. Lightning can strike twice, I guess, is the thing. Yeah. Yeah.
Got a couple more. Have we got any others in the room? I shall read these ones. I think you answered this really, but what is the likelihood of developing cardiomyopathy for people with a relevant genetic variant?
That's a good question. It depends on the genetic variant. So some genetic variants, we call it penetrance. So it's what is the chance that you're actually going to develop the condition, and it varies. So for genes like that TTN gene that I talked about, that's a low penetrance. So quite a lot of people have the gene and don't develop cardiomyopathy, whereas other genes might have more of a high penetrance. So most people that carry a variant within that gene develop cardiomyopathy. And the different variants have different penetrances as well. And we don't always have that stat because we haven't been able to study a lot of people with a specific genetic variant. So essentially, it depends on the gene and it depends on the specific variant.
You make it sound so simple. And the last one on the app is, why are people with the same genetic variant affected differently?
So I guess, hopefully I've covered it in my talk. So it's other genes that can interact, it's our environment, it's our lifestyle. Sometimes we don't know. There's lots we don't know. But it's because all of us are different and one gene doesn't determine everything. There's so many different factors in the development of nearly all diseases, but cardiomyopathy is the same. It's many different factors.